Welcome to the office.
How's it going, guys?
It's going pretty well.
All right, so we're back after a few years. I saw you yesterday.
I did forget to tell you about my PRP yesterday. What
happened? Because you've been I hadn't seen you in 3 years.
Right. So I was trying to find something a little closer to home.
Yeah.
I had been through some chiropractor, Gonstead, and otherwise nothing was working.
Okay.
I had super high hopes for PRP.
But here's the thing, before we get to the PRP, when you said you went to a Gonstead doctor, and there are a lot of people out there saying they do Gonstead, and there's at least some basic criteria, and you guys should be looking out for this, in the Gonstead system. 5 criteria or 6. Number 1, visualization with the consultation history taking. Number 2, instrumentation. They got a scope. A lot of guys are not scoping anymore because it takes time, or they're not proficient. Hold on. Scope, instrumentation, scoping with the meter, looking for the temperature difference. Number 2 is going to be X-ray analysis. Visualization, history taking, instrumentation, full spine X-ray analysis with pelvic analysis numbers, static palpation, motion palpation, and then the specific adjustment using the equipment. You can do the adjustments without the specific equipment, yes. But instrument, in my opinion, and if you're any Gonstead doc listening out there that's been doing this a while, if they're not doing instrumentation and X-ray analysis, are they still considered a Gonstead doc? And should they be in the referral directory? I don't know. That's something you guys got to decide.
In my experience, there were at least 3 of those steps not even taken.
Okay. It's done now. Let's move on.
All right.
PRP.
I tried PRP. I was closer to home. I had very high hopes for that.
Okay.
Spent about $10,000. It was very painful. It was helpful for a while, not very long.
Okay.
Maybe a couple months.
So here's the thing I learned about PRP. I was at a conference a few months back, and there's an MDDC out here who does it, and he's pretty good. And he explained something. And I didn't know this. And a lot of the guys that do PRP, this is him telling me this, it's not my experience. He said a lot of guys doing the PRP, when you sign up with the company for the PRP stuff, they give you a centrifuge. It's part of the initiation, whatever, right? But that centrifuge, it's like an $800 centrifuge. And it's not spinning it enough. You're maybe getting 2X. The machine he's talking about, and he spent the extra money, and a lot of guys have that too, it's about 10 grand. But that thing spins at 8 to 10X.
So it'll spin you some gold.
8 to 10X
Right, okay.
versus 1 or 2. So he says a lot of people don't get the result with PRP because of that one situation. I don't know the name of the machine though, but I'm just letting you know.
Right.
It's a difference between 1, 2X centrifuging your blood versus 6, 8, 10X.
Right.
Okay? So I just want to let you know that.
So it was some relief.
Okay?
There's just been nothing that stuck like you. There's been nothing.
Don't say too much of that.
Well, I don't understand why they don't practice or apply what they're supposed to do. I just don't understand it.
Well, some people will say, I don't do
That's
Gonstead.
right.
Some people will say, I do something else.
Well, this is
I don't
my
know.
experience. Their experience is their experience.
Sure.
I would rather save my time, money, and not be disappointed to come here where I know I'm going to be taken care of from head to toe.
All right.
How about you?
Ditto.
Ditto.
Okay.
I
thought I was okay.
Yesterday you thought you were okay?
I didn't feel like that was going to happen, but
I didn't feel that was going to
I
happen
didn't know that I was so out of whack in my pelvis.
Yeah, man. You ready for more?
Yes,
You were saying something. I'm sorry.
at times.
Okay.
But absolutely. I was talking to her yesterday. I said, we need to come down
Give her
probably
6 months,
3,
so it doesn't get to a place
4
where,
months,
oh my
6
God,
months
I can't
to
take it
where-
anymore.
And I have a lot of people that do that.
Yeah.
Some people come twice a year. They come every quarter. Some people come once a year. They spend a few days.
Mhm.
We got our peeps in Germany. They're coming back for
Oh,
another
yeah.
visit. You remember them?
Yes.
Yeah, I think.
Mhm.
Did you meet them?
No, I just watched so many of your videos.
Okay.
and
Well, I don't
everything.
have video with these guys. They're from Germany.
Okay.
No, I have a guy from Germany.
We get people from all
But there's
over
a.
the place.
Actually, I think it's about 95 countries right now.
I think
90?
it was Germany because I think if it was a 24-hour flight at the time.
Yeah, no.
Almost
I have 2 videos with 2 separate patients from Germany, but this couple, they've been out here 3 times over 2 years. This is the 3rd year now, and this is going to be their 4th trip. And they would rather come now once a year. They spend 3, 4, 5 days. They do traveling and whatever else. And that's their choice. So, in your situation, maybe every 6 months.
Yeah, right.
6 months. I think 6 months would be good.
good.
You ready to get started?
Yes.
Europeans get paid well for their vacations.
No, actually, no. They got to save, dude. How did you do with yesterday's adjustment? Tell me what's
was
different.
Fine. This morning I started feeling very emotional and sore.
Starting at the base. So the first break, it looks like here, but it doesn't stop. Goes right, left, and then it breaks up, top on the left atlas. But if you go way too slow and stop, guess what? It looks like the break is there, but it's not.
Oh, it feels like where you just pushed.
Yeah, there?
Mm-hmm.
I'm getting it here. So look, if I do this, it looked like it was going to do a break. That's muscle. Doo-doo. Let's try that again. I stand corrected. Got a tiny bit there on the right. All right. You don't hear that a lot on my videos, do you? Starting at the base, let's work our way down. Did it? T8, T9.
My breathing is sure a lot better today.
Breathing is better?
Yes.
Good. And here we go, here we go, here we go. Yeah. We're going to continue on. Let's see. Come back slowly. That's 1. That's 5.
Ew.
5 is a little That's 4. Let's check over here. Static palpation, running my fingers down the spine. And we're going to continue on right there at 9. We're going to come down to 9, 5 again. Come back slowly. That's 5.
Mm-hmm.
That's 1.
5.
5.
Real, yes, 5.
Oh, we can't get out of the basement that fast. Pelvis on the left. Not bad, right? That's cool. T9, L5. Sit back for me, please. Now, the problem with where you're complaining of, okay, I can't actually adjust it. I got to stay lower down because that's right at the reverse curve.
It's again to push his elbow down sometimes.
You want me to do an elbow? I can do an elbow.
Oh, really?
She
I'm
wants me to
joking,
push.
dude.
Sometimes I go, no.
Nah,
no,
dude.
she can
Nah,
push.
dude.
No.
Let's see.
No, her neck. She's put my elbow
Look,
on my neck.
6. That's 6. That's 6. 5, 4, 3, 2. It's there
Mm-hmm.
at 1. Okay, so we're going to do C1, T9, and L5 today.
Okay,
You ready?
I'm ready.
Let's do it, girl.
Ready?
Nope, you're sitting back when you're ready. Now it is C1, and C2 is tilted a little bit on that side. Sorry. I got to set 2 first on the right, and then 1 on the left. So let's do C2 first on the right. Nice and easy, set back. There you go. Hands on your lap. And let's bring that right ear, elbow down. That thing is so stubborn, girl. Oh. Let's see if I can pull it a little bit. Left ear down. Nope. Let's go over here. Oh, she's gonna make me work for this one. All right, here we go. C1, turn, slide up a little bit. You okay there?
It's just to height.
Get that pressure off. Chin down a little bit. It's a piece. Alrighty. Let's come up. And step away, madame. I gotta fix my cutoff switch. Walk it off, please. Back down on the gray table, please. 1, 2, 3, 4, 5, 6, 7, 8, 9. There you go. Good. There you go. A little more. Good. Gotcha. All right, let's walk it out. Take your time. Okay. Hi. But there wasn't a big crack.
Or shifting.
Oh, yeah. It's not just about let's crack stuff. We want to move the bones, get the pressure off the nerve. T9 is clear. L5 is clear. We'll check up top in a minute. I just want to feel. Come back. Check it out.
Oh, it's much better.
Look. Check it out. But it didn't crack.
I've never said that before.
No, I'm not saying you. You've never actually said that. Correct. Let's check up top now. All clear. I want you to feel now, based on what we did. Remember what that felt like? Remember?
Mm-hmm.
Different?
Mm-hmm.
They're actually moving.
Yeah, yeah.
Is
You
it?
hear little crackles, but
Is it tingling?
Is it
is
tingling? No.
Okay. Shoulder. Left side. On your back, please. All right, let's go ahead and do the ankle. AS talus, medial tilt. Posterior fib. AS tilt. Whoa, what?
There's a nerve on my. I have that nerve on my foot. You just touched it.
Got it. Can I do this way?
Yes.
Talus. Awesome. Come on up.
I kicked Vince in the face a couple of weeks ago by accident. He touched the nerve on my foot.
That's not good. Let's buff you out. C1, T9, L5 today, okay? You stand up
Can I
for
do
me.
extreme?
Squeeze.
I'll work the cold plunge. I'm not a big fan of being cold. My bad.
You're good.
Thank you.
You're all set. All right. You did pretty good with your adjustments, sir?
Yes, it was a little sore there. I put some ice on it for a few.
L5?
Yes.
Down low?
Yes.
Okay. Did you guys get a walk-in today?
Yeah, you go.
Okay. Lots of walking.
I did.
Yeah, he did.
I go
yes.
every morning anyway.
He walks every morning.
All right, starting at the base of the neck, let's see what we got today. Four points, C1, C2, left side, middle back is clear today. Still got L5, brother.
Oh.
4 points. I can be nice on the Hylo today. 5 points. L5, C1 today. Yeah, we might as well.
Somebody's pointing over
You've been
there.
talking about it for weeks. You're so excited.
Was he really?
Yes.
You
He
try.
can't wait to get up there.
You try.
He's been so excited.
Shut up.
I'm serious.
5.
There it is.
Yeah. Mid back is all clear. 5, and let's check up top. Sit back for me, please. It's actually C2 left. C2 left. And C1 right. C2 left. Let's do C2 first. You ready? Mm-hmm. Now for 2, I have to just lift it a tiny bit, just to clear. There it is. Wow. Drop, drop. He's not giving it there. Come on. Over here. Chin down a little bit. A little more. Down. There you go. On the left bifid, lifting it up. Gotcha. Sit back for me. And all the way back, please. C1. Now the angle's a little different. We've got to come down. Perfect. That's the home run. All right. Just breathe. Breathe through it. L5, the money. Drop that belly button down. Bring it up and down. Up and down. Up and down. Good. L5. That's the home run, baby. And that's the grand slam. Eh, Sakina? That's the grand slam. Come on up when you're ready, sir. Hold my hand. Just walk it off. Walk it out, sir.
Speaking in tongues.
I know you were. I thought it was some foreign planet language.
Comes out sometimes. I don't know what it is.
It's okay. Right on. Good. Have a seat. Neck is clear. Mid back is clear. clear. Check it out, sir. Cool.
See,
What? What?
remember.
This is 5.
F1.
This is 5.
Good.
Is that all good? It's all good in the hood. All right. Shoulders. On your back, please. Talus. Fibula. Talus. Fibula. Fibula. Come on up. And let's buff you up.
Okay.
Good stuff. Good. Enjoy the day, guys. You good? 4, 3, 2, and 1. What up? When I'm on the mic, the crackers run. Stand up. Squeeze. 1, 2, 1, 2.
Uh-oh.
Just a little thumb. The wrists are fine. Squeeze. Yeah, that's fine. Enjoy your day.
Thank you.
You're welcome. God bless, guys.
A little taller.
I wish I was a little bit taller.
I wish it was a baller.
Oh, you know what? You know all this stuff. You
I
know
know that
it.
one.
Oh, you know that one? Right on. All right, we're all set for today. See you guys on Friday.
Right.
I'm off
Right.
tomorrow.
Right.
Okay?
Okay.
Take care.
Will
Peace.
do.